Hi everyone. Good evening to all of you. This is Dr. Mike. I'm based here in Hong Kong. To all our followers, subscribers, and viewers, we're live both on YouTube and Facebook. And if you're new here, I'm Dr. Mike and I'm based here in Hong Kong. And we're doing this health talk by Dr. Mike, where we discuss different health issues, health topics, lifestyle, travel, and adventure. For today, we will be discussing what causes frequent urination. This would be our topic for tonight. I hope you would watch this, listen this from the beginning till end for you to find out because you might be experiencing this problem. But before we move forward, please do watch this. Yes, I'm back with our topic for tonight, causes of frequent urination. So, have you experienced this? How many times do you go to the washroom to pee or to void? So, this would be our topic for tonight or for today. For all the viewers, if you're new here, you could always watch our previous episode. If you missed those previous episodes, we have around 300 live episodes, all about different health issues, different health topics. You might be interested about myoma, you might be interested about cervical cancer, pancreatitis, gastric ulcer, etc. So you can go back to our library and you could watch our previous episode. Don't forget to like, share, and subscribe to our channel, Health Talk by Dr. Mike, here in YouTube. And also, you can visit our Facebook page, Health Talk by Doc Mike. Similar names. But anyway, let's move forward with our discussion for tonight. As I have mentioned, if you experience frequent urination, this might be for you. Excuse me. Okay. So the urination, this would be our topic for tonight. Let me drink first. Okay, because drinking is important for us because this is the process where urine is being formed. The moment that we drink water, it depends on how much water you would drink or any juices or so, because 1% of this filtration, etc., would be eliminated in the process of urine by the kidney, and urine would be void out. These are the waste products of all the different metabolism inside the body. So urine is formed. So this would be my discussion for today. So the frequent urination is also named as urinary frequency. So it's just similar term. This means having an urge to pass, and when you experience this, passing urine more often than usual. So some of our viewers might be experiencing this problem, particularly if you are drinking a lot, or sometimes you have a medical condition, so you may experience frequent urination. Okay, particularly at night or sometimes in any parts of the day. Okay, it can disrupt a person's normal routine, interrupt their life cycle, and could indicate an underlying medical condition. So this would be in terms of the frequency of urination. So watch out for this one to all the viewers, particularly our OFWs watching today. So just for the anatomy component, urinating is how the body would remove waste fluids. Urine, which contains mostly water, uric acid, urea, and toxin, stays in the urinary bladder until it reaches its threshold, a point of fullness, At this point, a person expels it from the body. Most people urinate 6 to 7 times per day. Just imagine how many times the frequency of voiding this urine. Frequent urination or urinary frequency is when us as a person needs to urinate more than 7 times in 24 hours if they have consumed about 2 liters of fluids across that day. So my question is, how many fluids, viewers, followers, that are you ingesting every day? Do you take at least 8 to 10 glasses of water per day or more? So you can answer this question properly. Okay? Or 2 liters of fluid, then how much urine frequency or volume of urine you may have. Moving on with our discussion. So, lifestyle causes include drinking a lot of fluids, especially those containing caffeine or alcohol, because many people live with frequent urination. Although there is often a simple explanation for an individual's urinary frequency, it can sometimes indicate a more serious condition. Early identification of the problem can lead to timely treatment, preventing possible complications. So, for the viewers out there, check your lifestyle. Do you drink alcohol? How many fluids a day? Do you drink coffee? Do you drink alcoholic beverages? So, the frequent urination can also indicate an underlying problem. So, what is this underlying problem? As I have mentioned, because sometimes lifestyle causes include drinking a lot of fluids, especially those that I have mentioned, caffeine or alcohol. And at night, this can interrupt the sleep cycle, which urges or with urges to urinate. And sometimes, as doctors, we call it nocturia. However, the frequent urination can also indicate an underlying problem. Some of some of these problems may include the following. Some patient may have kidney problems, ureteral problems, or sometimes problems about the urinary bladder, ureter problem, the prostate gland. These are the normal anatomical structures of a human being. You may have problems about the ureter, where the urine would pass to, or sometimes they would have problems about the bladder, urinary bladder. Sometimes it's inflamed, or sometimes among men, they may have prostate problem. So these may contribute to the frequency of urination on how many times. Okay. Other causes of this problem or related factors that can include frequent urination may include the following. Patient may have an infection in any parts of the urinary system, particularly UTI, urinary tract infection. Problems in the ureter, what we call, or inflammation in the ureters of a patient, we call it urethritis. Or frequent urination because of pregnancy, because the growing fetus may again have an impact or putting so much pressure on the urinary bladder. So therefore, there would be some kind of frequent urination. Another problem would be a tumor or a mass in the pelvic area, which would give so much pressure again to the urinary bladder. A bladder tumor may contribute to the frequent urination. Interstitial cystitis. This is a type of inflammation of the bladder wall, particularly in the urinary bladder. A stone, urinary tract stones, for those who love to take some vitamins, some uric acid stones, etc. These are just examples of urinary tract stones, particularly if you don't drink too much water. Then certain medications such as diuretics may contribute as well for the development of frequent urination. radiotherapy, and some medications, diuretic medications for high blood pressures, they may contribute as well to frequent urination. Also, those sexually active individuals, particularly if they acquire sexually transmitted infections, STI, such as gonorrhea, syphilis, chlamydia, and so on, and also neurologic problems. These are the common causes of problems, or these are common causes that would lead to frequent urination. So, patients, viewers, followers, if you experience frequent urination, you might be suffering from this anatomical problems in your kidneys, in your bladder, in your ureters. So you need to visit your doctor, your physician, because frequent urination may be related to the following causes that I have mentioned. So, in summary, urination is a complex process involving various body systems, so which includes the body structures, the organs from the kidneys to the ureters, urinary bladder, prostate gland for male, and sometimes there are certain conditions that may lead to frequent urination, such as pregnancy or some sexually transmitted illnesses. This means several factors and things can cause issues with the bodily process. So again, for all the viewers watching, for the viewers, all the viewers listening to our discussion, if you have these problems, okay, or the causes, and you are experiencing frequent urination, you need to visit your physician so that your physician can do further evaluation, do a complete history taking, a physical exam, and sometimes your physician would require you series of tests. The most simplest one is doing urinalysis. So once again, this is Dr. Mike. I hope you enjoyed this discussion, this short discussion about the causes of frequent urination. Once again, don't forget to like, share, and subscribe. And thank you to all our followers. Thank you to all our subscribers, and also to all our health supporters. If you want to become a supporters, one of our supporters in our Health Talk by Dr. Mike Facebook page, please click that become a supporter so that we can help more of our OFWs. Once again, this is Dr. Mike. See you again in our next episode. Have a great day, everyone. See you soon. Bye-bye.